For our next video on treatments of psychological disorders, we're continuing on with some of our psychotherapies, specifically looking at behavior therapies, then cognitive therapies, and cognitive behavior therapies. So these three all tend to go together really nicely, and as usual, when we talk about behaviorist approaches and cognitive approaches, we usually also stop in the middle at the combined cognitive behavior approaches. So that's the plan for this video. Now, starting off with our behavior therapies, again, unsurprisingly, we're looking at a very behaviorist-based approach. And as a reminder, our behaviorists, those are the ones that are very much focused on learning through experience. So they were all about the external environment and how our prior encounters can actually end up influencing how we act in the future based on whatever consequences we've seen in the past. So these are very different from some of the other concepts we've been talking about because rather than looking at sort of all of these different diagnostic categories and saying that there are problems in, say, with our psychodynamic perspectives, we're looking at issues within the unconscious mind. Or with our humanistic theories, we're saying that we are not able to sort of lead these fulfilling lives and it's causing maladaptive behaviors. With behavior therapies, we're actually focusing on the problem behaviors or the maladaptive behaviors that we're observing as themselves the problem, rather than focusing on them as a symptom of a larger problem, something that needs sort of a broader diagnosis and maybe a more holistic, sort of broad reaching treatment strategy. Here, the goal is to identify our maladaptive behaviors, our undesired behaviors that are causing problems, and try and eliminate them using very behaviorist approaches. So we'd say that our maladaptive behaviors are learned through classical and or operant conditioning, which means that we can then modify those things that we've learned, the behaviors that we've acquired through experience. We can modify those through other forms of classical and or operant conditioning and related concepts. Now, I stress here on the slides that we are modifying but not completely undoing that original learning. That's one of those really common misconceptions where people will talk about, oh, you've learned a fear of spiders, and now we're unlearning your fear. We're making it go away completely. Now, that's not quite how learning works. So instead, what we're doing is we're learning to not be afraid anymore. We still have the initial associations, all that doesn't change. We just learn something new that kind of sits on top. And that's just one of my little pet peeves because I teach a lot of those upper level learning classes where we really stress the fact that the old learning doesn't go away. We've just learned something new that's more relevant in the current situation. But yes, our goal here through our new learning is to try and maybe reduce some unwanted maladaptive behaviors. And maybe you can pair that with promoting more desirable behaviors. So usually we'll talk about decreasing some behaviors that we don't want to keep happening, hence undesired behaviors. Or we can also include new behaviors, new desirable behaviors that we would like to happen more. And sometimes it's more effective to actually do the two together. Because if you just teach somebody not to do something, well, what are they going to do instead? So if we give them a new desired behavior that we're encouraging, we can decrease the old one and increase the new one and shift their behavior a little bit more effectively. Now, from this, you can probably expect we're going to do a lot of sort of operant conditioning and classical conditioning related concepts. So the first of these is actually going to be related to operant conditioning. And a very quick reminder about operant conditioning, it's come up a couple of times throughout the semester, basically because whenever we talk about behaviorists, we bring up Skinner and the fact that he always talks about the fact that when a behavior is followed by a consequence, the nature of that consequence then changes how likely a behavior is to occur in the future. So when we talk about a behavior being reinforced, it means that something good is happening. So we can focus on, actually my example on the slide here, we can say that Tommy is going to be throwing a temper tantrum every time he goes to the grocery store with his parents. So that's a behavior, and we're actually going to talk about it as an unwanted or undesired behavior. But Tommy does this because every time he throws a tantrum, he actually gets candy from his parents because He didn't get his candy, he cries, they want him to be quiet, so they give him candy. So our behavior is throwing a tantrum, and it is reinforced by getting candy. From our examples of, all right, we have an undesired behavior that we would like to stop occurring, we are going to reduce this through something called extinction. And for operant extinction, we're saying that we're trying to reduce this undesired behavior, and we specify that the behavior has previously been kept around. It happens because it's been reinforced in the past. So Tommy throws his tantrums because the last time he did it, he got candy. The time before that, he got candy. So when he throws a new tantrum, he's expecting to get candy. But instead, extinction says that we're no longer giving you that reinforcer for doing that behavior. So what does that look like with Tommy? Well, it says he throws his temper tantrum at the grocery store, but he doesn't actually get candy. His parents ignore him. They don't give him attention. They don't give him candy. And so he's done the behavior, but our consequences changed. So now, if he's not getting candy when he throws his temper tantrums, he's eventually going to stop throwing a tantrum because it's not getting him what he wanted. So in this case, we'd say that his tantrum behavior went through extinction, or that we extinguished his tantrum behavior. So in this case, extinction is just one of our sort of things you can learn after operant conditioning has occurred. We're effectively modifying the original operant conditioning, where Tommy learned that if he throws a tantrum, he gets candy. And we're saying that's not the case anymore. The old rule doesn't apply. And now that thing has gone extinct. So he doesn't throw a tantrum because he doesn't get anything for doing it. So we've modified the situation. Now, again, that's operant conditioning. But we also have classical conditioning elements, and then we can also have both combined. But first, if we're talking classical conditioning, I'm going to use an example as both a reminder of what classical conditioning looks like, but also an example of how classical conditioning can lead to the formation of a phobia. Now, this might relate a little bit to what we discussed when we were talking about different disorders, but we're going to do it so that we have this fresh in our minds. So here we're talking about a fear of dogs. We're going to have an unconditioned stimulus. So this is something that we don't have to learn about this stimulus. A stimulus is literally anything that we can encounter. So here, our stimulus is getting bit by a dog. Getting bit is going to naturally make you experience pain and fear. So pain leads to fear. It's an unconditioned response or an unlearned response. Anytime you get bit, you're going to experience the pain and your autonomic nervous system is going to ramp up. And remember, that comes from when we talked about stress back in the stress and health chapter. But that autonomic arousal is our fight or flight response. We feel afraid, we're ready to fight or run. So, starting off, getting bit automatically makes you afraid. Makes sense. And because this is an unconditioned stimulus, it's something we're encountering that automatically leads to a particular response. We say it's also an unconditioned response. We didn't have to learn anything here. This is natural, automatic, biological. But because it was a dog that bit us, the dog is a new stimulus. And that dog was present when we experienced the pain that then led to the fear. So now, because the dog has been paired with pain and then fear, the dog alone becomes sufficient for us to experience fear. So again, we have some symbols here, but instead of an unconditioned stimulus, like at the top here, now we have a conditioned stimulus. And all that means is if it's been conditioned, we've learned about it. So we learned to be afraid of dogs. And our conditioned response is that we've learned to experience that fear in the presence of a dog. So when we started with just a natural arrangement, pain leads to fear, we're now saying that this dog was present when we experienced pain and fear. Therefore, you should also be afraid of the dog too. So we have classically conditioned a fear of dogs. And if we're talking about fear in this case, it's actually going to have some what we can call respondent or classical behaviors. So these are the ones that come from classical conditioning, and they're going to relate to fear. So this is your fight or flight response. This is your heart speeding faster, your muscles are tense, you're breathing too quickly. All of that ties together. And again, this is automatic. So classical behaviors happen automatically. We learned through classical conditioning to be afraid, so these fear responses automatically occur. We can also then include operant responses. So operant behaviors would be, I'm afraid when I see a dog. So when you're afraid, that's a really scary thing. It's a bad feeling. If I run away from a dog, that fear goes away. Having fear stop happening makes me feel better. By feeling better, we're actually reinforcing the behavior of running away from the dog. And what this means in the long run, and this is our problem behavior that's trained in here, is that I'm now more likely to run away from dogs in the future. Because the last time I saw a dog and I ran away, I started feeling better. So the next time I see one, I'm going to run away so I feel better again. So, same basic idea for operant conditioning here, but we're saying that this operant conditioning is creating this maladaptive or problem behavior, and we would like to use some fear specific strategies to try and reduce that operant behavior. So we have a couple of ones that are all sort of similar and are based on these learning principles. So the first is something called systematic desensitization. And this is going to mainly be used with people who have phobias, but it can be applied in other situations. But we're going to stick with the most typical, which is phobias. So we get somebody who has a phobia, so they have a severe fear of dogs, and we're going to get them to imagine progressively more frightening situations that are related to that phobia. We're also going to get them to practice relaxation techniques to try and calm their autonomic nervous system. The big stressor here is the fact that we are using imagined situations. So they're not physically encountering a dog, they're thinking about encountering a dog. So how does this work? First, we teach them some kind of relaxation technique. So this could be progressive muscle relaxation. This could be meditation. This could be something as simple as different breathing techniques. Whatever the technique is, it's something that's going to calm that autonomic nervous system. It's going to stop our fight or flight response, and it's going to help us feel calm. So now we're going to think about a dog that would make us afraid, and we're going to, instead of just panicking, we're going to breathe deeply, calm ourselves as we were trained. In order to go through sort of the whole process of systematic desensitization, we're actually also going to make that list of progressively more scary imagined situations related to the thing we're afraid of. So this is something called, so you use SUDS, the subjective units of discomfort scale, but basically it's just a scale from 0 to 100, and you start at 0 is something that's not scary at all, and then 100 would be something that is absolutely terrifying. So for our fear of dogs, this could be, I'm not going to use the dog example. I have my chart here for spiders. So replace spider with dog. So thinking about a dog is fine. You're thinking about the fact that you could think about a dog. If we wanted to think about maybe encountering a photo, so a photo is a little bit more tangible. We could think about actually being in a room with one. We could think about being next to one, touching one. So these are getting progressively more and more fear-inducing. And then once we've established our list, we're going to start at the bottom with the not super scary stuff. And we're going to get the person to think about the fact that they can think about dogs. Then we're going to say, okay, think about seeing a photo. Think about being in a room with a dog, but on the far side of the room. Think about getting closer to the dog. Think about touching them. Think about all of these things. And every time you're thinking about one of these frightening events, you're actually going to be practicing your relaxation to try and force that autonomic nervous system to slow down. And eventually, as you move through this list, you're going to get more and more skilled at slowing your autonomic nervous system. And eventually, thinking about a dog, even thinking about touching a dog, petting a dog, is actually not going to be super scary. And again, so stressing that that's all imagined stimuli. But oftentimes, you're actually going to start with systematic desensitization, start with the imagination, and then move into something called in vivo desensitization. In this case, it's the exact same logic, except now we're actually going to move into the real world. So now, instead of just thinking about encountering a dog, you're going to actually encounter a dog. Here at the bottom, I have somebody with a fear, or what we would use for someone with a fear of snakes, going from, say, a cartoon or a picture of a snake to a snake in a safe enclosure, to somebody near you holding a snake, to then you yourself holding the snake. And all of these, again, sort of escalating situations in terms of scariness, but you're going to continue practicing relaxation to try and slow your autonomic nervous system until you can do the scariest situation without getting super worked up. So you're slowly becoming desensitized to that automatic fear response through a combination of extinction, so exposure to the same stimulus where nothing bad happens, but also through that trained relaxation, which is something that we are sort of operant conditioning, because the more you relax, the more you do your deep breathing, the less fear you're feeling. So you're going to be more likely to take your deep breaths to calm yourself down the next time you're scared, because it's worked really well in the past. Another very closely related procedure is something called flooding. And this is, instead of sort of slowly working your way up to the scariest type of encounter you can think of, this is starting at the worst case scenario. So this would be if we had our person with a fear of snakes, they would start day one by being handed a snake, and they have to stand there and deal with it until they're no longer afraid. Basically, we're exposing them to the real fear for as long as possible until they stop being afraid of it. So this can be really effective because sometimes it can occur very, very quickly. Rather than that slow, gradual process of increasing intensity, we're going all in right off the bat. But the problem here is that we have some special considerations. The first being ethical concerns. Is it ethical to put someone in that stressful of a situation? There's also health concerns. If they are really, really scared to start, what's that going to do to their heart? Is there the potential for things like panic attacks? We also have behaviorist concerns, because what if the person is so scared that they run away? Well, now we've encountered, again, reinforcement for that escape behavior. Just like the person who ran away from the dog that they were afraid of and they felt better, so they ran away more often. Same thing here. If you run away from your snake holding incident and you feel better because you've gotten somewhere safe, well, you're more likely to run away the next time too. So this can be really, really dangerous. It could also be maybe unhelpful. It can make the problem worse. So they always stress that this is something that very much needs to be done with a trained professional. We can also talk a little bit about modeling, which has come up a couple of times this semester. But basically, this is a situation where you can watch somebody else engage in a behavior that you were maybe afraid to engage in. And by seeing them complete that action and not have any bad consequences happen, you are then more comfortable doing it yourself. This can be related to fear reduction procedures, so no longer being as afraid. It's actually been really useful in terms of, say, kids watching others go through medical procedures so that they don't feel so afraid when they do it themselves. But modeling can actually be used in tons of different scenarios, not just related to fear. And this could be as simple as seeing, say, their parent or their sibling engage in a desired behavior, especially if after doing the desired behavior they get praised. Well, the kid is then more likely to do that behavior themselves. So modeling is basically learning not through your own experiences, but learning through the experiences of others. So this can be a very good practice. A couple of other behaviorist techniques that can be useful. The first is token economies. These are really cool. So token economies are based on, again, we're looking at reinforcement. But instead of like our kid who's throwing his temper tantrum and he gets candy, so he's more likely to throw a tantrum again in the future, now we're not using something that itself is directly reinforced. So we're not using candy bars, we're not using chocolate, we're not using any kind of what we would call a primary reinforcer, meaning something that you want right now. Instead, what we use is a token. So this is something we'd call a learned or conditioned reinforcer, but it's basically some kind of neutral object or symbol that we can exchange for those reinforcers that we really want. So money is actually a special type of token because you get paid for doing desirable tasks. You go to work, you do your job, you get a paycheck. So our paycheck, that money, is now a token because we can use it to go out into society and buy the things we want. You can buy food, you can buy video games, you can buy whatever you want. And that sort of you can buy whatever you want also applies with sort of non-money based token economies, where you basically say, I have all these tokens, I want to exchange them for something that I really want. So you earn your tokens for doing desirable behaviors, and then you exchange them for reinforcers. If you wanted to get really complicated with a system, you could also have it where if you engage in one of those problem or undesirable behaviors, you can actually lose tokens. So if we had a situation where, actually, I have an example. So in this case, we have a list from one of the old papers I use in a different class. But here we have all of these different tasks. These are all desirable behaviors. And so if this individual engages in any of these tasks, they earn this many points. Those points can be considered tokens. At the end, once they've earned a certain amount of points, they can exchange them for reinforcers. Reinforcers cost a certain number of points, like paying money for whatever it is that you want, so they earn more points to be able to get more of the stuff that they want. And this can apply in a bunch of different situations. You could use things like, perfect, I gave myself examples. So if we're looking in a classroom and you want kids to maybe answer more questions in class, so you could use poker chips, something that doesn't mean anything really in the classroom, until you tell the students that they can exchange those chips in order to get, say, less homework, or in order to go for recess early, or something like that. They can also have things like using like Monopoly money as an exchange for stuff at a canteen or just like a small shop. You'll find that all these examples are actually from very controlled environments. So usually within a hospital, a classroom, a group home, something like that, because we need to control who gets tokens and for what. But in the long run, this is something that can be really effective to allow people to sort of learn to do desired behaviors, possibly learn not to do those undesired behaviors. And they do this by accumulating tokens for the good behaviors and getting to spend them on the things that they really want. Obviously, I suppose you can talk about the fact that just regular reinforcement could be effective in getting somebody to do a desired behavior. If you had, say, a kid who you would like to clean their room, you can just use normal positive reinforcement. Every time they clean their room, they get to go out for dinner. Well, that's now something that's going to be more likely to occur. They're going to clean their room more, so they get to go out for dinner more. So you could frame that in terms of behaviors that you'd like to increase that are relating to any kind of psychological disorder. But I figured I'd acknowledge it because I don't know that there's a specific slide that explicitly states it. But that gets us through the behaviorist stuff. What about cognitive therapies? And then we'll do the cognitive behavior therapies too. But within cognitive therapies, there's two big names, Beck and Ellis. And we're going to talk about these very, very briefly. But their main focus here is on cognition, the way that we think. So they say that we have these irrational and self-defeating thought patterns that are then leading to our maladaptive behaviors. So people tend to maybe think too negatively. They tend to be too critical of themselves. They tend to constantly expect the worst. And so these therapies would try and help the clients figure out how are they thinking, why are those thought patterns not helpful, and possibly try and change them. So can we learn how we're thinking? Can we think about why we think that way? And can we try and change that underlying architecture? So with Beck's cognitive therapy, specifically focuses on basically the concept of cognitive restructuring or restructuring the way that you think. So it's all centered around irrational beliefs and maladaptive patterns of thinking in general. So we can have beliefs, we can have ways of thinking that are not really true. So they're irrational. I believe that maybe I'm not very smart. And I'm going to be very critical of my academic performance because of that belief. So a therapist would try and point out errors of that thinking. So they might ask questions like, well, why do you think that you're not very smart? What evidence has led you to that conclusion? Can you think of things that might explain, say, if you pointed out, I got a bad mark on this one test? Well, is there another reason why you did poorly? Maybe the whole class did really bad on that test. Therefore, you shouldn't think too badly of yourself. So in this case, we're trying to help the clients identify where these maladaptive thoughts are occurring and get them to see why it's not really logical, why they are irrational. The really important part here, though, is that a therapist can't just tell you that you need to think more positive. I don't know about you, but in my experience, when you tell somebody to do something, they're going to resist if they really don't want to. So telling them to think a certain way is not super expected or effective. So instead, you're much better off to sit down and ask them questions that let them come to that conclusion that their thoughts were irrational and that they should maybe think about it a little bit differently on their own. So you can ask leading questions, you can get them thinking in certain ways, but they need to come to that conclusion themselves. And that makes the therapeutic approach much more effective and also much more likely to last longer and even generalize to other situations. So maybe we pointed out some flaws in their thinking about their academic career, but maybe they can use similar thought patterns, similar challenges to their irrational beliefs in, say, their workplace or in interpersonal relationships. So we're basically teaching them to identify built-in maladaptive thought patterns and challenge those in a constructive way. So at the bottom here, talking about these automated thought patterns, those are basically just our defaults, the stuff that's happening without us even realizing it. So we're drawing attention to it, challenging it, and encouraging a more adaptive way of thinking. Now, I've talked now about cognitive restructuring. So we're trying to replace some of these maladaptive or distressing thought patterns with more desirable or rational or functional thought patterns. So that matches what we've just been talking about. Something closely related is called cognitive coping skills training. And this is kind of a weird category, but what it's specifically doing is instead of just trying to pick apart why we think the way we do, what they do instead is teach people cognitive skills that are going to help them cope with some of these very negative thought patterns. So it's just what it sounds like, cognitive coping skills, ways of thinking to cope in certain scenarios. So what we do is we give people cognitive tools, things like prompting certain types of positive thought patterns. So things like repeating a daily mantra of, I'm going to do great today, or I'm a competent individual, or I'm a really smart student. Things like that can make you think a little bit more positively. So you can have certain things where maybe you're training yourself to recognize different stimuli in your environment that make you think a certain way, or think of certain things that make you feel a certain way. So something like a sticky note on your door that reminds you to smile before you walk out into the world, and to think about something happy, those could be some of those skills. We're keeping it really vague here because we're really just saying we're teaching you about different thought patterns that can help you behave in a more desirable way. So focusing on positive ways of thinking, and hopefully teaching you some of the ways of using those types of thoughts in situations that might cause stress. So you might have that sort of think highly of yourself, think that you are strong and capable and confident. And if maybe you're having a really rough day at school, this kind of training would make you more likely to remember that maybe I should run through my list of things that I'm really good at to try and boost my thoughts, instead of getting stuck in some of those more automatic negative thought patterns. But again, There's so many different subtypes of each of these. We could spend way too much time on it, but we're going to move very quickly to the last of our cognitive components here, looking at Ellis's rational emotive therapy. And this is basically looking at the fact that we want to identify an entire sequence of events that are leading to certain types of behaviors. And so this is getting us into that more cognitive behavior leaning strategies. But we're saying there's going to be some kind of stimulus, some kind of activating event in the environment. So something is going to make you start thinking a certain way. So we're then saying that activating event is going to trigger certain beliefs. So you encounter, say, a not good but not bad test score. You encounter a test score that's not as great as you'd want it. That activates the belief of, I'm not a good student. And then you have the emotional consequences and behavioral consequences that follow. So maybe now you're going to feel really low. Maybe now you're going to stop studying, stop trying because I'm already really not good at being a student. This is now evidence that's going to sort of support that. I should just give up. And then the approach here with the therapy is saying, all right, we identified that this grade was a particular trigger. It was our activating event. It led to these beliefs that you're not a good student. We're going to challenge those beliefs. Can we come up with different evidence? Can we come up with examples of tests that you've done really well on? If we can change those beliefs, we might have a better frame of mind when we encounter similar activating stimuli in the future. The next time you get a not fantastic score on a test, maybe because we've sort of restructured this, we've tried to sort of rationalize our emotional responses, we can hesitate before we get too worked up and start thinking about how awful of a student we are, and maybe remind ourselves that one bad test score does not make you a bad student. So here we're trying to discover what some of these different beliefs are and how they lead to these maladaptive behaviors. And we're going to try and change them by having sort of identified what they are and started challenging them in a more structured way. So again, all of these are very closely interrelated with one another, talking about how we think about things and changing how we think about things. And because it's cognitive behavior, here we're saying that changing our ways of thinking changes the behaviors that follow. So a really nice integration of the two.